So you know that the Commission projects a surge in prostate cancer cases, right, in the coming years. And we know that this surge cannot only be prevented by lifestyle and public health interventions. So, and another point is that the increase in mortality is particularly high, right, in sub-Saharan Africa. And because you know the major challenges of undertreatment, insufficient staging, affordability. Patients in most African countries have to pay out of pocket for this treatment, and also access, right, and availability. Some countries in Africa don't have radiotherapy machines, and they have to travel, right? People have to travel long distances just to access radiotherapy. In LMICs, we must also mention that we have different types, we have different financial profiles when it comes to patients. They're the rich ones who can actually travel out of the country, have access, pay out of pocket, right? And we now have the poor, right? The poor patients with challenges of affordability, with out of pocket payments, and they constitute a larger proportion of patients with prostate cancer. And prostate cancer patients would present, African men would present with more aggressive disease, and they also have late stage presentation when we compare them with the Caucasian counterparts. And so in order to maximize the use of radiotherapy to start with, it has to be available, right? These machines have to be available. Like I mentioned before, that some countries don't even have. Some have, but it's really, the numbers are not enough compared to developed countries. Then apart from it being available, the personnel have to be trained. We know that around the radiotherapy center, there's the clinical oncologist, there's a physicist, there's a dosimetrist, there's a radiation therapist. So we need training for this personnel. And like I mentioned also before, in my introduction, access. So the machine is available. Is it affordable? So if we really want to maximize radiotherapy in Africa, there must be availability, right? Like I mentioned, we know that most patients in Africa will present with late disease. And so what is offered is majorly palliative care. Treatment of pain from metastasis. Most prostate cancer patients would present late. So treatment of pain, and also prevention of all other oncological emergencies like cord compression from metastasis of the spine, bleeding, and the likes. So a lot of patients in Africa fall into this palliative category, but we still have that small number that, still benefit from localized treatments with radiotherapy. So we know that radiotherapy is an important component of prostate cancer management. And so in order to maximize it, it has to be available, right? And the personnel have to be available, it has to be accessible, it has to be affordable in Africa. And if we are able to put this in place, most likely we will definitely be able to reduce this surge of cases that is expected in the future.